Hello and welcome to Yodo. I'm Dr. Sarah Bohn, and the topic for discussion today is frailty. You probably have a picture in your mind of what frailty looks like just from me saying the word. That's a worrisome word to have attached to a person. For some patients, frailty comes on slowly, so slowly that it may not be noticed by the person or family. For others, it may occur after a sudden health event or an acute trauma. Frailty is an increased vulnerability. The person has a limited potential to recover homeostasis after a stressful health event. Frail patients have a higher risk for adverse outcomes and typically need assistance from others. Frailty is difficult to describe. It includes a number of things in its causes, symptoms, findings, and outcomes, and this makes it important, but it also can be hard to quantify. Sometimes frail patients and their family members do not agree that they're frail. To be informed of this, that you're frail, can be unacceptable information. To have it and not hear about it and not learn about it can expose you to unnecessary risks. There are multiple assessments that are used to evaluate frailty and tools that are used by many specialists. Frailty determination can be done by numerous disciplines. First, though, let's look at a tool commonly used by physicians to help them determine if someone has frailty. The frailty spectrum in an evaluation tool called the FRAIL scale covers robust, pre-frail, frail, and very frail. This evaluation tool provides for evaluation of each of the following: fatigue, resistance, ambulation, illness, and weight loss. And that's how they came up with the name for FRAIL scale. Most of these measures are self-reported. Fatigue, for the purpose of the evaluation, is the amount of time in the prior 4 weeks that a person admits feeling all the time they're fatigued, most of the time, some of the time, a little of the time, or none of the time. And those responses are graded 0 and 1. For all the time and most of the time, those are scored as 1, and the remainder are scored at 0. The other questions on the screener are yes/no responses with 1 point for yes and 0 for no. Resistance is difficulty walking up 10 steps alone, without rest and without assistance. Ambulation is the difficulty that a person experiences walking several hundred yards, alone and without aid. Illness is the number of illnesses from a list of 11. If there's less than 4 illnesses, 0 points are acquired, and if it's 5 or more illnesses from a specific list, 1 point is given. And last on the FRAIL scale evaluation is weight loss. Greater than 5% or 10 pounds of unintentional weight loss in the prior 12 months is 1 point. The list of the 11 conditions that are considered on the FRAIL scale component list includes illnesses of hypertension, diabetes, cancer, excluding like minor skin cancers, chronic lung disease, asthma, history of heart attack, congestive heart failure, even if it's managed, recurrent angina, even when managed, history of stroke or cerebrovascular atherosclerosis or mini stroke, and kidney disease. As you can see, there are not many possible points on this screener. It's a pretty tight scale. A person without any points on the scale is a robust person and has no frailty. They're fully functional. A pre-frail individual that scores 1 or 2 points on the scale is likely to demonstrate the onset of frailty. There's slight increase in their vulnerability and a lesser ability to recover after an insult to their health. A frail individual by this scale has 3 to 5 points that they score, and this person exhibits characteristics consistent with the syndrome of frailty: loss of independence, increased risk for illness, slower recovery from a medical event, and higher overall rate of adverse outcome. Additionally, frail individuals are more likely to need assistance for their activities of daily living and their instrumental activities of daily living. A very frail individual scored on this is someone that is very near total care or may be needing total care and could possibly be in a pre-death state. This is someone having multiple disease conditions that causes heavy burden to them. Next, let's look at what's behind the cause of frailty. That would be an analysis of the pathophysiology of frailty. It reveals that this is a complex interaction of many factors across multiple domains. The process of aging in and of itself can greatly contribute to frailty due to many factors. We'll go through a few of those: aging, muscle changes, appetite, medications, weight, neuroendocrine system, nutrition, and incontinence are going to be what we'll tackle in this video. This video turned out to be the blob, so I've broken it up into 2 videos. First of these is senescent muscle changes. Unavoidable, normal muscle loss that does occur with aging. Let's start with muscle bulk, tone, and strength. Loss of muscle tissue as we age is well documented throughout literature. Many people don't realize that loss of muscle tissue will add to the burden of a disease, and the effects from that disease process will be compounded. Nearly every disease process is going to progress over time. There's just a natural tendency for them to advance. And as time passes, typically these changes occur from a disease state and they'll increase and cross over to involve other body systems. The normal decline of muscle results in the decline of walking skill, safety, and speed. And this potentially leads to a number of concerns, either occurring alone or in combination. One of these that's particularly concerning is the fall risk. Fall with the possible injury from trauma caused by the fall can lead to disability and dependency. You can imagine the progressive events occurring after an initial fall, especially if weakness, instability, and balance issues progress. As a person becomes less active, whether by a natural process or if it's after the effect from an illness or surgery or injury, there's a decrease in the total energy expenditure. As a person is less active, their basal metabolic rate will decrease, and this is going to result in other domains becoming affected, thus further advancing this worrisome chain reaction that leads to frailty. The factors of age, muscle loss, and disease combined with altered nutrition, which is also common with aging, typically results in weight loss. Unfortunately, we lose muscle mass faster than fat stores are lost. We can have an altered lean body mass with proportionally more fat tissue than muscle tissue. This results in less strength to carry ourselves around, further affecting a person by decreasing their mobility, energy, strength, stability, and ability for recovery. As a sidebar, there are a few types of recovery that I'm going to talk about here. More than just the recovery from an illness, but immediate recovery, say from a slip or uneven footing. Think about the purpose of a quick knee-jerk reaction, possibly tripping on a pet or throw rug. The person might recover their footing and rebalance themselves quickly and not fall. If the person doesn't have that ability anymore and they go down all the way, trauma can occur. When a fall results in a person hitting the ground, this can cause significant injury and be a terrible setback for some. For others, it might represent the event after which progressive decline continues, begins to occur, and is ongoing. So I'm including the needed quick response for recovery from the slip or trip that prevents the fall, recovery from injury after a fall, as well as including recovery from an illness or a few days of inactivity. Okay, let's get back to the body systems. Recovering after a hospitalization. Time, care, and assistance is often going to be needed. Intervention may include treating an infection or healing after surgery. It can take significant time to get better. We typically advise patients for each day spent in the hospital, 5 days of recovery is needed. That's probably shocking to learn. There are a lot of reasons for this. When a person is in the hospital, most of the time it's because of a serious medical issue. A person has to have significant medical issues just to get admitted anymore and have an overnight stay. The illness, as well as just being in the hospital, are both insults and typically are going to result in a setback for the person. Discharge from the hospital occurs when the patient is medically stable, not when they're well. And there are a lot of reasons for that, and we're not going to go down that rabbit hole here. I could explain that at some point in time if you're interested, but not today. Next, therapy, when it's available in the hospital, is very limited. Typically, therapists do assessments, evaluations, and provide rehab recommendations when the patient is hospitalized rather than providing therapy geared toward improvement and restorative care. And likewise, there are a lot of reasons for that, and we're not going to go into those either. Keep in mind that while a person is in the hospital, they don't feel good, so they're reluctant to do very much for themselves at all, and they rely heavily on the staff. Staff is reminding them every time that they enter the room to call for help when they get out of bed because of the increased risk for fall. They may have an IV, they may have oxygen tubing, and the IV pole and oxygen tubing makes it even more difficult to get up out of a bed and makes them feel tethered. The illness or medications that are being used are different than their normal. They may be out of their normal element, and all that can lead to a patient having episodes of disorientation or confusion. There are slippery floors, the hospital gowns are uncomfortable, they have issues with lighting, too little of the right kind of light in the right place. Also, the time that the lights are on, as well as the location of the light switch. A person can get their nights and days mixed up pretty easily in the hospital. A patient may have a special diet that they have to follow. They might be a little bit homesick. I know that if I'm gone for very long, I miss my pets, my family, and just being in my own place, in my own home. And if I was in the hospital and sick, I think I would be a little bit afraid, if not a lot afraid. The health insult to the patient that's resulted in the need for hospitalization has likely been devastating, and at times recovery to that prior state of health and function is just not possible. If an insurmountable amount of injury and decline has occurred, the patient might now be frail when they were not frail before those changes occurred, before that hospitalization, before that medical incident, before that fall. Sometimes full recovery is just not going to occur. Consider a severe heart attack or severe stroke. With a lot of therapy, medications, and time, the patient can improve, but there are occasions when full recovery to that prior health state and full function that they experienced before, that skill level return is not going to be possible. Being encouraging is good, yes, but false hope is damaging. That was a big deviation, but an important one. So I want to get back to the processes of aging that contribute to frailty. We've touched on weight and nutrition, and I need to talk more about these. Aging can also result in declining appetite and change of taste with new texture preferences becoming established. Both of these can be anticipated to occur. It's common for these to occur as we age. New taste and texture preferences can be established as we get older. Anorexia of aging is an independent process from disease states. Many things can make this process worse, though. We can't completely keep it from occurring. The declining appetite of age is not related to medications. It's just part of aging. Let's take a sidestep to medications for a moment. Although medications that a person is taking may be adversely affecting their appetite and taste in addition to the normal changes that the patient is experiencing, those medications may be necessary. Medications being used to treat an illness or disease process, whether that disease is curable or not, it may inadvertently cause further unwanted changes. Many patients receiving chemotherapy, antibiotics, and some heart medications all have notorious reputations to alter taste in an adverse way. I'm sure that each of you can think of medications that can alter taste. Ask anyone that took Paxlovid. This taste perversion is common with many medications as well as several disease states. Anyone that had COVID in 2020 or even since can tell you that it took them a long time to get their previous sense of taste to return, and some feel that it never did return normally. Other illnesses and disease processes such as kidney disease, liver problems are also common to have taste issues associated with them. Some disease states require special diets. But even when a person may occasionally eat a food that's not on that diet, a food that they used to love as an occasional treat, they'll comment these don't invoke the same taste memories for them that they once did. Many patients have told me it just isn't the same anymore. For some, unfortunately, the altered taste is a permanent condition. Thus, whether from a disease process or medication, the effect is the same as for folks who have changes occurring due to age. If they occur together, it complicates that problem even more. The change in perception of taste and sensation from food texture changing over time is really common, and when combined with other contributing causes, that weight loss can occur maybe greater and can occur faster. This is likely to further decrease the person's intake and adversely affect their weight and nutrition, as well as impact their mobility. Sadly, medications to increase weight do not work as desired, and they only add fat tissue, not muscle mass, and that's not the effect that we're going for. Other elements contributing to this multifaceted issue of how nutrition affects frailty is that aging often causes mouth and digestive issues, dry mouth in particular. Dry mouth can further alter taste interpretation. Dry mouth can lead to oral irritation and contribute to a person not wanting to eat. Any one of these things can interfere with the perception of taste. Sweet, salty, bitter, and savory just are not appreciated the same way by the person as they did in the past, and it's changing on its own. Then adding the issue of dry mouth or irritated mouth worsens this. If there is oral irritation, mouth sores or ulcers, or possibly thrush, Texture can also make a big difference. We must include dentition in this category too. Dental disease, poor gum health, and the need for dentures become more common as we age. Dry mouth and poor oral hygiene and even some medications will worsen this issue. Dental care is expensive, and few seniors have access to affordable interventions. Do you know anybody that's paid for dentures lately? Yikes, those are expensive. As the person has further weight loss, then the dentures that they've got will not fit the same way, and we're back to square one on that issue again. Next, let's look at a tangled, interconnected communication system that the body relies on, the neuroendocrine system. This is the transmission of information between the brain and organs by the use of electrical stimuli and hormonal molecules that serve as communicators. Neuroendocrine dysregulation is another process that typically occurs with aging. This short phrase describes a typical change that can occur in this convoluted and interwoven information system. The system is what the organs of the body and various glands in the brain use to tell each other what they're doing and what they need the others to do. The endocrine hormones come from individual organs or glands. The amount of hormone, the timing of release interval is based on information coming from other glands and organs, as well as from stimulus from the brain. This feedback system is sensitive, and slight disruptions in the amount of hormone, timing of release, or receptor function of the receiving organ can all get the system off track. Some hormones are bound to certain fats or proteins, and if those are altered by a medication or a disease process or nutrition, our problem gets really complicated very quickly. For many patients, when the system is not working well, the function of one of these decreases, it can cause issues that cascade like dominoes, and the repercussions affect other systems. The brain and each of these organ systems needs to be fully functional for everything to work properly. Our body truly is remarkable. For just one example, consider how the thyroid system works. Coordination between the hypothalamus and pituitary glands in our brain and the thyroid gland in our neck are all working together necessarily for this to work properly. The correct amount of thyroid hormone needs to be released, and if any one of these malfunctions, the effects are felt throughout the entire system. A person's thyroid being off can make them feel fatigued, have trouble sleeping, affect their appetite, change blood pressure, impact heart rate, result in fluid retention, affect mood, foul up female hormone levels, plus cause changes in our weight, our hair, and our nails. This is just one example of the many interrelated pathways of the neuroendocrine system that our body relies on so heavily. With aging, the amount of hormone released alters. Also, the timing of the response can be slowed, and the sensitivity of the end organ receiving that stimulus may be reduced. Okay, let's get back to nutrition. This nutrition thing has a huge impact on a person, and it's not an easily solved issue. We've touched on this a bit already with discussion of oral health and appetite. Nutrition is not only appetite and eating. Sure, getting protein, fats, and carbohydrates into a person is important, but it is way more than just getting those calories from the mouth into the gut. The gut needs to absorb those calories, nutrients, vitamins, and minerals. Then the cells of the body need to be able to utilize those things correctly, and age can impair the appropriate absorption and use of all these nutrients. Even when presented at the right time and the right amount, as we age, we don't use these the same way that we did when we were younger. To further reveal just how complicated this is, there are many other issues that can occur to affect us adversely. Difficulty with swallow is not uncommon for aging people, and it's to be expected with some disease states. GI upset and food sensitivity or intolerances may surface. Too much acid or too little acid, resulting in altered stomach pH, can lead to incorrect preparation of nutrients. I see so many people now that are on PPIs indefinitely, and this interferes with absorption of some crucial nutrients. The intestines may not be able to absorb what is consumed. The chemicals of our saliva are an important part for some food digestion, so dry mouth is more than just a nuisance. The swallow and stomach acid are important. The bile and pancreatic fluid contributions to the other chemicals and food in the upper duodenum, and of course, all that needs to be in proper proportion. All of that is important. With each of these, the importance of appropriate amounts, concentration, and timing is significant. When these are off, Undernutrition is the result, and this is how poor nutrition can occur even with a balanced diet being presented. I hope this helps demonstrate how chronic undernutrition is common to occur even when providing sufficient calories, vitamins, minerals, nutrients. It's such a complex process, and this can be expected to progress and worsen over time. Before you run out to the supplement store or the nutritionist, be informed that there is not a pill, a shot, IV, or infusion out there that can replace a fully functional gut. Certainly we have to provide the nutrients, but the individual must be able to absorb and utilize them. Sometimes because of the chemical structure of the nutrient, it just can't be absorbed except through the gut. We have many life-sustaining treatments available for several organ systems, but the gut is not one of these. Is that a lot to digest? How cheesy was that? Let's get back to the muscles and let's talk about weakness. Muscle strength and importance for that is not just limited to the skeletal muscles that we think of in our arms, legs, and spine, but this also includes the muscle in our urethral sphincter. This typically doesn't work as well as we age either. Incontinence is twice as likely in a frail person. And conversely, a frail person with incontinence has an elevated risk of health events. There are many reasons for this. Some are common regardless of gender, and others are unique to men and some unique to women. Hormonal decrease or outright hormone dysfunction in females is common with age. Most women have a natural decrease in estrogen production after about age 50, and this typically is progressive. Additionally, for women that have had childbirth, carrying a pregnancy changed some of their anatomy, and with delivery there was likely perineal trauma. Injury to the pelvis and muscles of the perineum is common as a culprit that contributes to female incontinence. Combine this with muscle atrophy locally and across the rest of our body that's occurring with age. I'm more surprised when a female tells me that she does not have some element of incontinence. Men likely have influencing factors of prostate health that contribute to their incontinence. History of injury or disease, again, add another layer to that dysfunction. Incontinence is something else that we look for when we're evaluating frailty. So in summary, frailty is like this huge iceberg that's out there floating with a lot of danger hidden beneath the surface, and we really need to be watching for it and take proactive steps to avoid it. This is enough for today. I'll post the other part of this information in a later video. This next segment will contain information about the relationship of mental health to frailty, as well as many other things, including some treatment options that are available. Thanks for being here. Thanks for clicking the subscribe, and leave a comment below if you want me to talk about a particular topic. See you again soon. Bye now.